The committee has asked the DCI and EACC to investigate and take action against those behind the KEMSA scandal. As the MPs showed their dissatisfaction on the state of COVID-19 in the country, they expressed their concern on the implementation of the findings and the recommendations of the Health Committee.
Suspended Kenya Medical Supplies Authority KEMSA CEO John Manjari may soon find himself at the helm of another investigation after the National Assembly Health Committee told the august House that there were irregularities in the procurement of COVID-19 equipment.
Number two, that the Director of Criminal Investigations and Ethics and Anti-Corruption Commission undertake investigations on the suspended Chief Executive Officer on the following grounds. One, for the irregular and unauthorized expenditure of KEMSA's fund contrary to Section 68 and 74(4) of the Public Finance Management Act 2012 through procurement of COVID-19 related HPTs.
The Health Committee further asking the Directorate of Criminal Investigations DCI and the Ethics and Anti-Corruption Commission EACC to probe the main actors of the much publicized scandal.
The recommendation from the committee is that the Director of Criminal Investigations and Ethics and Anti-Corruption Commission undertake investigation of the procurement process at the Kenya Medical Supplies Authority with a view of establishing if there were any procurement malpractices and institute appropriate legal action.
However, the implementation of the committee's findings and recommendations were questioned, with the members of parliament raising concerns on the possibility of prosecuting the suspects.
I think maybe, unfortunately, what has been happening is that a lot of cases have been going there and maybe people are not seeing them bite. I want to say this is the time we want to see EACC bite, because this is a tragedy against this country.
Mr. Speaker, there are many, and I want to challenge the President. I want to challenge EACC. I want to challenge the Office of the Director of Criminal Investigation that do not be part and parcel of those who, in my own words, quote unquote, committed genocide against many Kenyans.
To limit overstepping between the DCI and EACC in the investigations, the National Assembly passed the recommendation that the EACC be allowed to lead the investigations.
That which is subject to insertion of Recommendation 40, that where two or more agencies are recommended to undertake investigations by the committee, the Ethics and Anti-Corruption Commission be the lead agency. Will as many as of that opinion say aye? Aye. As many as the contrary opinion say nay? The ayes have it.
The members of parliament also expressed their dissatisfaction with the disheartening state of COVID-19 in the country.
This country has laid down the health workers simply because of selfishness, simply because we don't care, simply because corruption has become our top priority in this country.
The results of that exposure are what we are witnessing today. Our medical doctors and health workers dying in numbers because they do not have protective gear, they do not have facilities that they are supposed to work with.
Let us call a spade a spade. There are people today, all of us sitting here, have lost our loved ones. We have lost our friends. We have lost our constituents. We have lost our colleagues on the basis of the corruption that took place in KEMSA.
As many Kenyans continue to test positive for the virus with little resources to fight it, all eyes are now on the government to see whether the orchestrators of the KEMSA scandal will be prosecuted. Musa Salah, TV 47.
President Uhuru Kenyatta has expressed